It is an honor to share with you some history of St. Alexius, the mission and values we live and express there, and our commitment to sponsorship of the Ministry of Healthcare. My community, the Benedictine Sisters of Annunciation Monastery, take pride in the stories of our founding, the developments and initiatives that occurred there over the past 140 years. We watch, observe with prayerful interest current activities evolving there. It will be helpful for you to know something about Benedictines. We follow the rule of Saint Benedict, from which and to which we attribute our mission and values. The rule, written by Saint Benedict very early in the 6th century, "It is nothing harsh or burdensome," Saint Benedict wrote. The rule provides a framework or guide for our life in common. It is based on the gospel and urges followers of Saint Benedict to imitate Christ in ordinary daily life under the leadership of an abbot in the case of men monastics or prioress in the case of women monastics. Benedict states the leader takes the place of Christ. In chapter 2, he writes the superior or prioress is believed to hold the place of Christ. For over 1,500 years, Benedictines have flourished in the Church. From Italy, where Benedict lived, Benedictine monasticism spread to other parts of Europe. Immigrants from European countries coming to the United States in the early 1800s brought Benedictine men and women as well. Our particular group of Benedictines came from Bavaria, Germany, first to Pennsylvania, then Minnesota. The Benedictine women came to assist in the religious formation of the children of immigrant families. Benedictine sisters from St. Benedict's, Minnesota, came to Bismarck in 1878, following Benedictine priests who served at St. Mary's Parish in Bismarck and St. Joseph's Parish in Mandan. The Bismarck Tribune reported on March 21, 1878, quotation, "Sisters of the Order of St. Benedict arrived to open a new academy with a plan for boarders, along with children of the parish." End of quotation. Students were welcomed the next day, March 22nd. Father Chrysostom was quoted as saying, "The school is not a sectarian one." This is important to note, for the education offered by the sisters would be inclusive of children of other religious denominations and Native American children. In this ministry, the sisters were fulfilling the gospel works of mercy, as St. Benedict mandated in chapter 4 of the rule. You must relieve the lot of the poor, clothe the naked, visit the sick, go to help the troubled. The sisters also expressed chapter 53 of the rule. All guests who present themselves are to be welcomed as Christ. A short time after the arrival of the teaching sisters, healthcare became a major concern for people of Bismarck and the surrounding area. Businessmen of Bismarck consulted with Abbot Alexius Edelbrock of St. John's Abbey about this concern. They agreed to purchase the Lambourne Hotel to serve as a hospital. Abbot Alexius asked Mother Scholastica Kirst of St. Benedict's Convent for sister volunteers willing to offer healthcare services in Bismarck. Up to this time, the Benedictine sisters had not been involved in hospital work. However, they were well formed by chapter 36 of the rule, Care of the Sick, which instructed, "Care of the sick must rank above and before all else, so that they may truly be served as Christ. For he said, I was sick, and you visited me, and what you did for one of the least of these, you did for me. The Lambourne Hospital, as it was called at first, opened for patients on May 6, 1885. The hospital was blessed by Abbot Alexius on May 3, 1887, and at that time was renamed St. Alexius Hospital. I want to focus on Sister Boniface Timmins, who became hospital superintendent in 1892, and actually she's really the one who put St. Alexius on the map, so to speak. Perhaps her leadership style would not reflect the definitions of leadership we know today, although she was a servant leader. She was prayerful, considerate and resourceful, innovative and dedicated in her responsibilities in leading St. Alexius Hospital. In a memoir, Sister Boniface wrote, quotation, "Most of our patients were county cases, and their bills were paid by the county in warrants. Often we experienced insufficient funds to pay our bills. A lady friend of mine, an old-timer, she said, 'Let's go and see the businessmen.' So we did, and within 2 hours we collected $800 and were told to come back if we needed more." The sisters solicited funds in unique ways. One described the sisters riding a hand-pumped rail car with railroad crews, going from camp to camp, asking for financial support. Sister Boniface was very active as administrator. One of the first things she did at the Lambourne Hotel was throw out the old sheet iron stoves and install a steam heating system. With the coming of electricity, Sister Boniface replaced kerosene lamps, replaced handbells used by patients to summon a nurse with an electric light call system. She wrote in her memoir, quotation, "I often recall the great excitement when the first telephone was installed. One day when a man came around with 6 telephones, I bought all 6. I remember how hard it was to get the telephones in. All the doctors agreed to have them installed in their homes, but one said he would do so on condition he would not be called at night. Sister Boniface said he was the main reason I wanted the telephone service, because he lived on the edge of town." There are other notable initiatives of Sister Boniface. One was determining the location and construction of a new hospital building on 9th Street. The building opened for patients in 1914. Part of that structure is still in use today. Another initiative was to begin the St. Alexius School of Nursing in 1915, graduating the first class in 1918. In 1925, the construction of Boniface Hall was a residence for nursing students. With the School of Nursing and Boniface Hall, the hospital had assurance of a nursing staff. Student nurses were assigned some duties on hospital units. Many nurses stayed on after graduation as employed nurses, offering a healing presence, respect for the dignity of each person, and often a prayer with and for the patient. Listen to Agnes Guthrie's memories related in an interview in 1885, the centennial year for St. Alexius. Agnes was a member of the first class of nursing students. She was quoted as saying, "The routine nursing duties were probably the same as today. In the early morning, we gave baths and medications, and of course, surgery was going on. We would take care of surgical patients after surgery. We had to carry patients up to surgery and back down to their rooms. I can still see them carrying the stretchers down the steps." St. Alexius served a large Native American population. We were kind of foreign to them, she said, and we were curious about each other and our different cultures. It wasn't too long, though, until we came to love them and a bond of trust developed. And here is Agnes's memory of Sister Boniface. She said, "It was Sister Boniface who introduced me to my husband. I still admire Sister Boniface. She would take us down to the grove for picnics near the present priory, that is, our monastery. She was very good to employees and treated us royally. She believed in charity for those who couldn't pay their bills." Other comments I'd like to add about Sister Boniface: she was the founding member of the Catholic Hospital Association, which is now called Catholic Health Association. Catholic Health Association plays an important role in relationships with Catholic bishops in the United States. They have a concern with sponsorship endeavors, upholding ethical and religious directives, as well as incorporating Catholic social teaching, among which are dignity of the human person, common good, stewardship of creation, and so forth. Sister Boniface was firm in her commitment to keep the facility upgraded for patient care. She promoted ongoing education for staff members, giving them opportunity to attend meetings, learn new techniques and methods to enhance patient care. Sister Boniface retired to St. Benedict's in Minnesota and died in 1937, shortly after she retired. Now back to our history of North Dakota Benedictines. By the early 1940s, many sisters serving in the Bismarck Diocese agreed with the newly installed Bishop Ryan that a separate foundation of Benedictine sisters in western North Dakota was needed. At St. Alexius alone, about 40 to 50 sisters were on staff in various departments. Another 50 or 60 teaching sisters staffed elementary schools in Dickinson, Mandan, and Bismarck. Responding to the request from Bishop Ryan, Mother Rosamond of St. Benedict's, Minnesota, asked for volunteers to establish a foundation in Bismarck. 140 sisters responded. The new foundation, the Benedictine Sisters of Annunciation Monastery, was approved in Rome, March 24, 1947. Our first prioress, Mother Decora, was deeply committed to leading the new independent community according to gospel and Benedictine values. While her background was teaching, she quickly learned the need for dedicated and professional care of the sick. She consistently and gently reminded members of the Benedictine community to be faithful to our common life with regular times for prayer, meals, study, work, and recreation. We began Mary College in 1959, a 4-year Christian Catholic Benedictine liberal arts college. The St. Alexius School of Nursing became part of the Mary College Division of Nursing in 1960, thereby granting a bachelor's degree in nursing. Sisters were the first teachers at Mary College, and as our predecessors before us, we taught and worked with our lay sisters and brothers in education. And the same was true at St. Alexius. We recognized the importance of cooperating and collaborating with others in all our ministries. An example of this today is the Nursing Academy, a cooperative program sponsored through the University of Mary, CHI St. Alexius, and Sanford Health, offering nurses the opportunity to learn a degree in about 2.5 years. Our community's commitment to healthcare in North Dakota these 75 years as an independent monastic community included the opening of hospitals in Garrison, Riverdale, Beulah, Bowman, and Richardson. The hospitals in Garrison, Riverdale, and Beulah were opened to accommodate those employed in the construction of the Garrison Dam. Of these, Bowman and Garrison continued to provide health care for their communities. The Bowman civic community assumed ownership and management of the hospital there in the late 1950s. It's now called Southwest Healthcare Services, and we continue to sponsor Garrison Memorial Hospital. Well, what has happened since our foundation in 1947? Here are some highlights of the activities and accomplishments of past administrators at St. Alexius, which I think are of interest. Sister Madonna Wagendorf was administrator of Garrison Memorial Hospital for many years. She also served as a certified registered nurse anesthetist, or CRNA, at Garrison, assisting with surgeries there. She commuted to Hazen to assist with surgeries at Hazen Hospital when called on. Another, Sister Jane Cook, business manager at St. Alexius, was instrumental in enrolling medical staff and patients in Blue Cross Blue Shield of North Dakota. Sister Jane, a faithful, dedicated Benedictine, was mindful of the poor. She found ways to provide financial assistance for the poor who struggled to support their families and pay their bills. She called on business people who would provide aid for some of these people. In this, she and other sister administrators continued the example of Sister Boniface, collaborating with civic leaders. Sister Andriette Rohrenbach served from 1941 to 1948. Sister Andriette's main concern was providing for more space for patient care. The north wing adjoining Rosser Avenue was opened in 1948, making St. Alexius the largest hospital in North Dakota. After leaving St. Alexius, Sister Andriette assisted with the operation of hospitals in Beulah, Richardson, Riverdale, and Garrison. Sister Mary Mark Brown served from 1948 to 1952. She arrived in Bismarck in 1935 during Sister Boniface's tenure. She commented in an interview in 1985, quotation, "When I arrived in Bismarck, Sister Boniface gave me $5 and said, 'Buy whatever books you need and go to Milwaukee to learn about special diets.' When Sister Mary Mark returned, no one on the medical staff knew much about special diets. Therefore, few were ordered. I wanted to do more work," she said. Sister Boniface said I should be a nurse, and I could start training the next morning. After working as a nurse, she was named administrator in 1948. Each day, she would still return to patient floors for rounds. She had served as director of nurses, director of St. Alexius School of Nursing, and eventually chair of the nursing division at Mary College. In 1948, during her tenure, the School of Radiological Technology and the School of Medical Technology were opened at St. Alexius. Sister Paul McCarthy followed Sister Mary Mark, serving 1953 to 1966. In 1964, St. Alexius began the Central Dakota School of Anesthesia. During Sister Paul's time as administrator, the psychiatric unit opened and physical therapy and occupational therapy programs were started. Sister Joanne Graham served from 1966 to 1976. She initiated total patient care, which included physical, spiritual, and emotional care. She directed long-range planning with the development of a master plan for the facility to enable and enhance patient care. She experienced federal and state government participation in creating healthcare policies with restrictions and limits on funding. During Sister Joanne's tenure, a study was conducted to examine the feasibility of combining the two Bismarck hospitals. The result was the two hospitals did not agree on which services would be offered at each of the hospitals. At St. Alexius Intensive Care Unit and Neonatal Intensive Care Unit were added, and affiliation with the UND School of Medicine was enacted. Mr. Richard Chider served from 1976 to 2005. Dick was our first lay administrator. Hospital reimbursement became a challenge. He dealt with implementation of Medicare, Medicaid, HMOs. He worked faithfully with administrators at Mid-Dakota Clinic and Bone and Joint Clinic. At St. Alexius, the Heart and Lung Clinic was added. Boniface Hall was demolished, and a new building, also called Boniface Hall, was opened with an auditorium, clinic space, and physical therapy areas as well. Annunciation Monastery's Gospel Works of Mercy continue today. Sponsorship of Ministry on the Margins was initiated in 2013 by Sister Kathleen Atkinson. This ministry offers assistance to those who leave the state penitentiary and are looking for work and a new beginning. At the Ministry on the Margins, we offer food pantry items for the homeless and others in need. With support of CHI, St. Alexius, we are assisting the development of Stepping Stones Ministry. This work of mercy is to provide a safe and healing environment for homeless individuals who are recovering from injury or serious illness. While their beginning efforts have been challenging and stressful, Sister Idell and Martha Reichert are determined to move ahead with the project. And as our tradition tells us, they are working also with local civic community people to make this a successful project. 1985 marked the 100th year for St. Alexius. We claimed at that time we consider ourselves pioneers in some respects, always looking for new and better ways to serve the healthcare needs of this region. In September 2014, after extensive and intensive study and prayerful consideration, St. Alexius Medical Center signed an affiliation agreement with Catholic Health Initiatives, becoming CHI St. Alexius Health. The move was an effort to meet the challenges of changing healthcare demands and needs, and to strengthen our commitment to provide quality healthcare in North Dakota. The Benedictine Sisters of Annunciation Monastery continue to sponsor St. Alexius and Garrison Memorial Hospital. We are deeply grateful to all who embrace our mission and values at St. Alexius. We ask God to bless you for your spirit and goodwill to receive all as Christ and care for the sick above and before all else.